Welcome everyone to the 7th instalment in the GSMA webinar series, using mobile big data analytics to combat challenges, including COVID-19, the in-country spotlights and lessons learned edition. My name is Rob Childs. I'm the strategic engagement lead for the GSMA's AI for Impact initiative, and I'll be hosting today's session for you. For those of you joining us for the first time, welcome. This series was conceived as a means to support and share knowledge, to showcase some of the great work already being done in this area, but also to help those that are new to develop a foundation level of understanding on how to establish the provision of and use of mobile big data analytics services. And before we move to look at today's agenda, I would like to first highlight that this initiative has been funded by UK aid from the UK government and is supported by the GSMA and its members. The views expressed, therefore, do not necessarily reflect the UK government's official policies. As already mentioned, this webinar is the 7th in our series. In the earlier instalments, we've set out the main considerations and best practice principles for mobile operators and governments looking to develop and adopt impactful products and services to aid their decision making. Building on these, today's theme is a continuation on from our last webinar, Mobile Big Data Analytics from Theory to Application. And so we will focus further on AI for I's ongoing in-country engagement activity, where with Foreign and Commonwealth Development Office funding, AI for I has been supporting collaborative projects between governments and mobile operators in response to COVID-19. In today's session, we'll be focusing on efforts in Benin and the Democratic Republic of Congo. For this, I'll be welcoming my colleague Nicolas Schnell, who's the Senior Insights Manager supporting AI for Impact and is part of both the Benin and DRC in-country support teams at the GSMA. Nico will join me to answer questions alongside Dr Eric Adja from AFRIA. AFRIA is the French-speaking agency for artificial intelligence, and we will discuss progress to date and lessons then from the work in Benin. Then Nico and I will be joined for a discussion by Popaul Punza from the Technical Secretariat for the Response Against COVID-19 in the Democratic Republic of Congo, to cast a spotlight on the valuable work undertaken there, as well as to bring you a demonstration of the dashboard that has been developed for use. And after the focus on these two countries' activity, I intend to share some aggregated learnings and recommendations from AI for I's in-country activity since the beginning of the COVID-19 pandemic, before then finally letting you know where you can access more information on the best practices shared in the series, including also a new report that we're publishing to support the sharing of these learnings, titled Utilising Mobile Big Data and AI to Benefit Society, that will enable you to get a more detailed view into the AI for Impact's COVID-19 response via the in-country engagements. To set the scene though, I'll begin with a very quick recap of GSMA's AI for Impact initiative and related activities. So the AI for Impact initiative was launched in 2017 with the aim to scale up mobile big data analytics and AI for the United Nations Sustainable Development Goals. Supported by a task force of 21 mobile operators from around the world and also an advisory panel of 12 UN agencies and global partners. At the global level, we're working to establish a common framework for the implementation of mobile big data projects. That involves defining the technical, commercial and ecosystem needs, as well as the privacy and ethical requirements to deliver sustainable products and services. And then at the local level, the initiative delivers cross-sector collaborations where operators working with governments and partners together to deliver products and unlock market opportunities. From the outset of the pandemic, GSMA's AI for Impact team has been working to share knowledge, best practices and principles. And to support this objective, we specifically established this webinar series. If you haven't been able to join us for previous editions, I would encourage you to take a look at those. Recordings of them are available on the internet and the AI for Impact homepage, and the webinar link is on the slide for you, but we'll also share that with you at the conclusion of today's session in case you don't capture that now. I won't go into specific detail on each of these sessions, but suffice to say each of them act as a deep dive into what we consider to be the most important topics when developing mobile big data and AI solutions. So starting with the privacy and policy considerations and the technical delivery and adoption needs, through to offering an appreciation of the ecosystem of partners and stakeholders that contribute to successful solutions. And of course, not forgetting the need to establish sustainability for these solutions and activities via appropriate funding models. Which brings us neatly to today's session focused on the in-country application of mobile big data analytics and AI. Now, since the COVID-19 pandemic emerged, the AI for Impact team with FCDO funding has been running a global knowledge and insights workstream, monitoring mobile operators' activities with a focus on the application of mobile big data analytics. And we've been capturing the approaches and seeking to understand where and how they are working with governments to identify the lessons learned. To date, there are 40 countries where mobile big data analytics work has been or is currently ongoing that we've captured. And alongside this global insights work, AI for Impact has also contributed to activity in 14 low and middle income countries in Africa and South Asia. The initiative specifically has supported the development of mobile big data products in 4 primary countries, those being Benin, Burkina Faso, the DRC, and Rwanda, and to implement mobile big data analytics and AI decision-making tools with the aim to support COVID-19 response and recovery. And then in a further 10 additional countries, we provided light touch support, providing global insights, data privacy support, and building skills and capabilities. The AI for Impact approach for in-country engagement follows a set of progressively complex use cases, starting from population and mobility insights to advanced analytical tools that leverage epidemiological, logistical, infrastructure, and economic vulnerability modeling. The approach to the individual country work has been guided by a 6-phase engagement process. This is designed to facilitate collaboration among stakeholders and to successfully deliver scalable, sustainable, and replicable solutions. In practice, going through the 6 phases is very much an iterative process. So it has regular feedback loops used to refine the preceding steps throughout the project lifecycle. And the engagement process formed the basis for stakeholders to collaborate and co-create valuable mobile big data analytics products and services, and to quickly adjust to the fast-changing situations that have marked this pandemic response. Active participation of the supply-side partners in co-creating these solutions and in the product development has been a key success factor and has resulted in the rapid implementation of both pragmatic and robust solutions and ensured that the highest standards of data privacy are met with these. And today we're going to talk to some of the stakeholders involved in the delivery and utilization of these solutions. So let's first begin with a focus on Benin. As mentioned at the outset, I'm pleased to be joined by Dr. Eric Adja. Eric is the president of AFRIA, and they are the French-speaking agency for artificial intelligence. And also my colleague at the GSMA, Nico Schnell, who's a senior insights manager who's been engaged closely in the Benin in-country activity. I'd therefore like to thank Eric and Nicholas for joining us today to share with us their experiences and ambitions for the Benin work. But before going into the Q&A discussion with them, first I thought it would be useful to give a little bit of context on the in-country activity in Benin itself. The first thing to highlight is that the project in Benin is very much an ongoing activity. So the insights and the lessons we will share today are of the moment. I'm sure that will come out in the Q&A with Eric and Nicholas. So to help set the scene a little more, from the outset of the in-country engagement, it was acknowledged that there's been a limited understanding of mobile big data amongst local stakeholders in Benin. And yet the government were very receptive to and indicated a positive interest in implementing mobile big data to strengthen decision-making in the country. Hence, a public-private partnership was created between three ministries, the GSMA and its local partners, to scale mobile big data analytics with both short and long-term goals. In the short term, the focus has been to identify the government's key needs and priorities, to build capacity and business cases, the development of a tailored prototype, which I'll ask Nico to tell us a little more about a little later. And all of this while seeking to integrate aggregated, anonymised data in a time-bound and transparent manner. And then to the longer-term objective, the focus from the very beginning of this engagement has been to seek support for sustainable scaling. So sustainable scaling of capability development and capacity building with a view to ensure the continued development of big data and AI ecosystem in Benin with all the stakeholders involved. In terms of those partners involved, there are several. The GSMA's AI for Impact team, with support from the local partner AFRIA, have been coordinating conversations between the Ministry of ICT, the Ministry of Health, the Ministry of Communications and Post, the regulator, the mobile operator MTN, and also other stakeholders to work together on solutions. Now, AFRIA are also an important contributor to the longer-term objective of sustainable scaling of this work and are committed to expand the local ecosystem beyond the GSMA engagement in country. And we, as the AI4I team, see this as being crucial for the continued development of mobile big data use cases and solutions in the country. So with that brief introduction, I would like to move to the Q&A. And therefore, I'd like to invite Eric and Nico to join me. Eric, if I may, let me begin with you. And so can you please tell us a little more about AFRIA and your focus on strengthening the mobile big data and AI ecosystems across French-speaking Africa?
Okay, thank you, Robert. Thank you, Nicola. And I would like to thank GSMA for this opportunity of sharing our experience in Benin as far as mobile big data is concerned. So AFRIA is a French-speaking agency for artificial intelligence. We are headquarters in Geneva, Switzerland, with offices in Paris, in Cotonou, and very soon in Vietnam, Abidjan, and Libreville for Central Africa. So as you know, training and capacity building in artificial intelligence represent one of the main pillars of AFRIA's mission to reveal and support the talents of tomorrow and to promote AI and digital sector in Africa. This is why we work with government, we work with academia for research activities, and we also work with international partners. This is why we are very happy to partner with GSMA in Benin for the implementation of educational program. This is why we are very interested in and involved in projects aiming at strengthening mobile big data and AI ecosystem across French-speaking Africa, because we are convinced that there is a link between big data and AI and sustainable development in Africa. Thank you.
Excellent. Thank you, Eric. So, in terms of Benin more specifically, can you perhaps explain for our audience what you see as the relevance for using mobile big data and AI in Benin specifically?
As you know, Robert, Benin is one of the first West African country to have passed a digital bill 2 years ago in order to develop digital activities, digital economy, big data, and various digital issues. This is why AFRIA is very concerned in supporting the government of Benin effort in implementing an overall digitalization process concerning almost all administrative process. So this creates a huge amount of data to be processed with security. For instance, the Ministry of Digital Economy is currently preparing a national artificial intelligence strategy. Therefore, AFRIA has seen a great need and an opportunity and an expressed interest by the government for capacity building at various levels: governmental level, private entities, academia, NGOs, MNO, etc. This is why one of the mission of AFRIA is to increase trust and understanding of mobile big data issues and AI issues by focusing on partnership to develop country-specific use cases. This is why AFRIA is involved in this AI for development project that GSMA has been pioneering and has been proposing us to join.
Excellent, thank you. And we appreciate the local expertise and knowledge that you bring to the activity as well. Building on that a little bit and perhaps focusing on the partnership creation that you mentioned, can you please tell us a little about some of the other partners involved in this activity and how those broadly coming together has contributed to this work?
So we have three governmental partners, private partners, and international organization, international partners. So in Benin, AFRIA is partnering with GSMA, with the Ministry of Communication, the Ministry of Health, which is the Ministry of ICT. So these are the three main ministries, but there is a fourth ministry which is also the Ministry of Plan for statistic. So in the government side, we have also the regulatory authority for electronic communication, and so this is the governmental partner. The private partners, we have the MTN Benin. MTN Benin is involved. We have also other partners like the Chamber of Commerce and other private stakeholders who are very interested in joining the project. So as far as the international community is concerned, we can mention Enabel, which is the Belgian cooperation agency. So we have also great interest from the World Bank office in Benin, and also the UNFPA office in Benin. These are the main partners involved in the project in Benin.
Brilliant. Thank you, Eric. Thanks for sharing
If
this. Sorry, go ahead.
If I may add something that is very useful, GSMA and AFRIA, we have decided to focus also on building a local ecosystem. So for local content, we have also chosen a local organization which name is Autrice Consulting for the in order to prepare the kind of local expertise for the project.
Excellent, thank you. Yeah, I think it's important that you highlight that the it's a key focus that we've had in all of our in-country activities to ensure that as many local stakeholders that are relevant are involved as possible, to make sure that there's that true knowledge transfer and capability transfer that takes place. So perhaps pausing the questions for yourself, Eric, for a moment. Nico, I'd like to bring you in at this point. And earlier on in the introduction, I made a reference to a dashboard or a prototype that's being worked on. Can you perhaps tell us a little bit more about what that is and what's happening with that?
Yes, of course. Hi, Rob. Yes, so the prototype in Benin, focusing on the development of, as you say, of a tool or of a dashboard that will put in perspective risk modeling that we co-developing with the World Bank, with the developments of impact and evaluation from a team from the World Bank. So it's a model that has been already developed in other countries, in DRC, for example, where it's also being deployed. And it's a model that takes into account different metrics that are available related to the risk of the COVID-19. So it could be socioeconomic indicator, some health data on comorbidity metrics that are linked to 19, and of course some mobility indicator linked to mobile big data that are important in terms of COVID-19 spread. So all those indicators are taken into account into modeling, and of course depends what kind of data is available in the country. So the model differs a bit from place to places, and the good thing with that is we can always improve the model by adding a new data sets or refining the data. But in the end, we can have a map of the country and try to prioritize which province or which health districts is the most at risk given the spread of COVID-19. And that's what we want to do with this dashboard, to help the government officials to navigate through this prioritization work, so it can be used in different contexts. Maybe it can also be used for vaccine distribution or for prevention, this kind of action. And so, of course, you will be able to see why this specific example is most at risk than another one. Is it because of socioeconomic factor? Is it because there's a strong mobility going in and going out from this specific district? So it can be different reasons. But that's where the visualization and dashboard will help to understand what creates this risk modeling. So yeah, of course, it's still in development. So unfortunately, we cannot show you anything today, but we hope we'll be able to give a quick snapshot of how it will look like in a very short term.
Great, thanks, Nico. Really, really useful. I think one of the questions that we've had raised a number of occasions across the webinar series, particularly when we're talking about dashboards and visualizations of data, etc., is the question around data privacy and data protection, and but also then looking further and related back to the longer term objective is around, I suppose, the commercial sustainability for the partners involved. So do you have any thoughts on that topic? So around importance of data privacy and protection, and then maybe as a secondary point about the commercial sustainability of the solution.
Yes, definitely. On the data privacy points, of course, because it's about mobile big data and about health data in some manner as well. It's a touchy topic, and for that reason, the GSMA really wants to put the standard, the highest standards, and want to abide by the strictest standard in terms of data management, in terms of privacy. So it's really important to understand that every personal data is only managed by the mobile operator themselves and not by someone else, and ourselves or our technical partner have only access on data that has been anonymized and that has been aggregated. So non-personal data is shared with any other parties in this kind of project, and in general, we are making sure that all our partners, from mobile operators, from technical developers, and so on, respect those GDPR standards for every project we're working on. So it's really important to us. And on the sustainability, of course, our goal is to make sure that this project, those tools will be used and will be continuing being developed once the project is over. That's why we also want to make sure that the partner we choose are willing to continue beyond our initial support, and I think that's the case with AFRIA, that is well implemented in Cotonou, and with a local partner Ultris as well. Same with the World Bank, they want to continue working there, and of course it's a prototype, so I think the opportunity lies behind this prototype are numerous. I mean, of course, now it's focusing on the COVID-19, but the good thing with this kind of modeling is that you can tweak the data, the parameters, so that the risk modeling can be used, can be adapted to another epidemics, to another problems, because we know that this mobile big data can be useful for, of course, for the epidemics, but also for complete other issues that are linked to mobility, for example. And so we really see this prototype as a foundation, as a first building blocks to start implementing those kind of digital tools, digital solutions with governments, so they can understand how to use data, how to use the dashboards to try to better understand the situation and to take the right decisions. So we want to make sure that it will go beyond the prototype.
Excellent. Thanks, Nico. Appreciate you sharing your perspectives there. And maybe just in the interest of time to wrap up this conversation, Eric, turning back to yourself, I'm interested to understand how you see the future for this activity, but then also beyond the current activity. Where and how do you see applications using mobile big data analytics being valuable in Benin in the future? And I suppose, what really then do you think needs to happen to achieve this?
Okay, thank you very much for this insightful question. AFRIA is very honored to partner with GSMA in this project because we have discovered that big data analytics and data-driven service can play a critical role in digital life and will continue to do so in the future. So AFRIA thinks that by using big data analytics, we can enhance connected cars, smarter homes, smarter cities in Africa, like everywhere, and more important, smarter healthcare systems for the post-COVID vision. You know, so we think that big data analysis can contribute to a positive impact on societies, so on societal aims, such as the UN Sustainable Development Goals, and we can deliver more effective health outcome, better environmental management, increased opportunities for learning, and improve goods and service for consumers. So, in short, to wrap up, as you said, we think that big data analytics can change the way we live for the better. In short.
Excellent. Thank you, Eric. And thank you both, Eric and Nico, for joining me today to shine a light on the work that's ongoing in Benin. And I wish you well for the continuation of this great work. Turning now to DRC, and just before bringing in my next guest, Popaul Punza, for Popaul to share with us his experiences of the work delivered in DRC as one of the end users. Let me first begin with a brief introduction and some context around the work in DRC. So as many of you will know, the DRC unfortunately has a long history of infectious disease outbreaks, including endemic malaria. And the first case of COVID-19 in the country was reported on the 10th of March in 2020. And at that time, DRC lacked accurate population data and previous experience of mobile big data analytics, which bringing us to the problem statement, driven by that lack of reliable data, specifically for COVID-19, but also with potential for use in other epidemics. The government was seeking insights to identify where, when, and what populations were the most vulnerable to the COVID-19 outbreak, and to identify where support was needed. The objective, therefore, was to provide a set of dynamic dashboards and reports to help policymakers understand nationwide population movements, as well as to identify hotspots in the capital city that could have support and communications deployed. Then going further, there was also potential to use this epidemiological modeling to understand transmission and to create an alert system for people living in high-risk areas, for example. And then looking beyond the Ministry of Health's immediate needs, there were also requests for knowledge sharing with the Presidential Task Force and the Scientific Research Ministries. And as already alluded to, the partners included the Ministry of Health, the ANASIS, which is the National Agency for Clinical Information and Health Informatics, Kinshasa Digital, mobile operators, Flowminder, Path, Dial, and also the World Bank Group. So with that brief introduction, I'd like to invite my next guest, Popaul Punza from Secretariat Technique, who are responsible for the response to COVID-19 in DRC, to join me. Hi, Popaul. Thanks very much for joining us. Could you tell us some of your experiences of using the dashboards developed and the mobile insights that have been delivered, how they've helped in the COVID-19 response in DRC?
Ok, merci. Bonjour, chers amis. D'abord, au nom du secrétariat technique, nous vous remercions pour l'intérêt que vous accordez à la riposte à travers ces nombreux outils qu'Ekin Digital a mis à notre disposition. De prime abord, je vous rappelle que je suis membre du secrétariat technique en charge de la communication et du partenariat stratégique. Donc, j'ai été à la conception de ce projet. Qu'est-ce que ça a apporté à la riposte? J'ai mis ça en 3 étapes. La première, c'est que une de nos faiblesses, c'est la gestion de données. Ça, on ne peut pas répéter ça autant de fois. Alors, cet outil nous a permis d'abord d'avoir des données, je suis tenté de dire indiscutables, sur l'épidémie, par exemple, en termes de déplacement du personnel, quand nous avons commencé par les confinements de la commune de la Gombe, les mouvements de population, toutes les données au niveau des centres de prise en charge, en termes des malades hospitalisés, en termes même de provisionnement au niveau des hôpitaux. En fait, c'est un outil qui, à mon avis, a été pour nous une espèce de livre ouvert dans le cadre de la rationalisation de la riposte. Nul n'est point de vous rappeler qu'au départ, nous avons eu des problèmes de données. Alors, si vous avez, je prends l'exemple simple, si vous avez 5 hôpitaux dans la ville de Kinshasa et vous ne savez pas combien de malades sont hospitalisés dans ces hôpitaux, si vous avez confiné un coin et que vous ne savez pas combien de personnes entrent et en sortent, si vous avez des coins qui demandent le déplacement des équipes de prise en charge, vous n'avez pas des données. Vous travaillez comme si nous étions dans l'âge de la pierre taillée ou polie, je ne me rappelle plus. Donc, bref, pour moi, pour être bref et sincère, l'outil nous a permis de rationaliser nos stratégies de riposte.
And so what do you think of the mobile big data analysis? And by that I mean, how and why is it relevant for improving the work around epidemiological modeling of the virus?
Ça a été démontré noir sur blanc qu'une des facteurs qui favorise l'expansion ou la montée de l'épidémie, c'est les mouvements de personnes. Et toutes les stratégies en Europe et ailleurs se sont focalisées sur le mouvement de population. L'idée, c'est de diminuer qu'il y ait moins de mouvements de population pour espérer rompre la chaîne de transmission. Alors, dans les mêmes ordres d'idées, ça nous a permis en termes de mouvement. Par exemple, je prends l'exemple comme la commune de la Gombe. La commune de la Gombe doit avoir une centaine de milliers de personnes comme habitat. Mais chaque jour, il y avait un mouvement de près de 3 millions de personnes. Vous vous rendez compte? Ça veut dire appelons ça, une commune de 150 à 100 à 150 000 personnes recevait chaque jour au moins plus de 2 millions de personnes. Ça, c'est un élément important. D'abord, le savoir, c'est déjà un élément important. Et aussi, la commune de la Gombe, pour le contexte de la RDC, a été la commune pionnière en termes de nombre de cas. Ça voudrait dire, si la commune de la Gombe avait beaucoup de cas, si nous laissions les gens entrer en désordre de la commune de la Gombe, les malades allaient dans leur, disons, en rentrant dans leur commune, amener la maladie. Ces éléments-là des mouvements de la population nous a permis de comprendre le flux migratoire qui entre de la Gombe vers les autres communes et des autres communes vers la Gombe. Ce qui a fait que nous avons mis, par exemple, des barrières d'accès au niveau des portes d'entrée de cette commune-là. Ça, c'est un élément important que nous a, comme je disais tout à l'heure, rationalisé, parce qu'au départ, nous nous disions, bon, les gens venaient beaucoup à la Gombe sans avoir des données assez fiables et justes sur la réalité. Donc, le mouvement de la population était un facteur important dans l'expansion de la maladie, et l'outil nous a permis de... pas contrôler, j'exagérais, nous a permis d'avoir une vision globale sur le mouvement, sur les flux migratoires de l'entrée et à la sortie de la Gombe, donc de Gombe vers les autres communes et vice-versa. Ça, c'était très important pour nous.
Thank you. And so then looking to the future and beyond the current COVID-19 work, what other applications do you see mobile big data and the insights delivered being valuable in DRC? So how are these digital tools that have been developed, how can they be leveraged in context other than perhaps COVID-19?
on peut pas, je prends l'exemple simple, nous ne pouvons pas parler aujourd'hui de la lutte contre le paludisme, les sida et même d'Ebola si nous n'avons pas des données réelles. L'avantage de l'outil, par exemple, aujourd'hui, cet outil peut être appliqué dans n'importe quel problème de santé. Moi, je pourrais même extrapoler, même au niveau de mouvements démographiques, ou même au niveau des recensements. Bon, ça, c'est trop long pour nous, restons dans le domaine de la santé. Cet outil peut être utile non seulement pour la COVID, mais pour les stratégies, d'abord pour la surveillance de toutes les maladies endémiques et même pandémiques dans notre pays. Nous pouvons utiliser cet outil. Mais aussi, nous pouvons l'utiliser pour rationaliser les structures de santé. Je prends l'exemple. Si nous savons, par exemple, le nombre de lits qu'il y a dans tous les hôpitaux de la ville de Kinshasa, et nous savons les spécialités qui prennent en charge telle ou telle pathologie, tel ou tel problème de santé, nous pouvons déjà, dès le départ, orienter. Je vais prendre un exemple. Nous nous disons, par exemple, tout ce qui est brûlure et tout ça, les problèmes de peau, à l'hôpital de Kinkole ou de Kinjili, il y a 50 lits avec des dermatologues, des spécialistes à la matière qui peuvent prendre en charge. Et que pour tout le problème lié à la chirurgie, par exemple, orthopédique et tout ça, à l'hôpital de Kitambo, il y a des spécialistes avec des lits et tout ça. Donc, il y a moyen, j'insiste sur le mot rationalisation, parce que nous n'évoluons pas à vue. Donc, nous avons maintenant une espèce de tableau de bord qui nous permettent dès le départ d'avoir la situation globale, une cartographie réelle d'une situation X dans une surface donnée. Donc pour moi, c'est un outil indispensable aujourd'hui en plein 21e siècle.
So do you have then, as a longer term objective, to use the dashboards and mobility insights in response to epidemics that are currently active in DRC? So I'm thinking, of course, around Ebola, for example, but maybe others as well. Is that a goal that's pursued by the secretariat technique?
L'idée aujourd'hui, nous considérons ça comme une expérience réussie dans le domaine de la riposte contre Covid et essayer d'implémenter ça dans les d'autres domaines de la riposte. Je prends par exemple, nous contrôlons tout ce qui est maladie à potentiel épidémique. Je prends le monkeypox, je prends la fièvre jaune, je prends la rougeole, je prends la polio. Nous devons maintenant être en mesure, c'est vrai qu'avec la polio, on a travaillé sur la vaccination, nous devons être en mesure aujourd'hui de dire, par exemple, avoir une cartographie réelle de la situation de la poliomyélite, à la fois en termes de nombre de nouveaux cas, mais aussi tout ce qui est la chaîne de la prise en charge jusqu'à la prévention et la vaccination. C'est vrai que les efforts sont assez organisés au niveau de la communauté internationale par rapport à la polio, qui est une urgence mondiale, mais la volonté est clairement exprimée et plusieurs fois répétée dans le sens de rationalisation et d'éviter de continuer à travailler, sortir des sentiers battus, donc travailler avec des données réelles. Et par exemple, nous disons, au niveau de la coordination, nous pouvons, à travers notre ordinateur, nous avons un écran où nous faisons de conférence call, dire par exemple, ici nous sommes à Kinshasa, voici la situation en termes épidémique, nombre de cas, de décès, de ceci et de cela, la disponibilité des lits, de l'expertise, et même aller en termes, parce qu'il y a eu, par exemple, je considère ça comme des faiblesses dans la riposte, il y a eu des moments où il y avait rupture de ceci et de cela. Simplement, nous ne savions pas que dans tel centre, il y avait un problème où la remontée de l'information sur le plan administratif dans le contexte de la RDC, il faille que le médecin puisse écrire au médecin chef de zone, les médecins chefs de zone puissent à son tour écrire au médecin provincial, les médecins provinciaux puissent nous écrire. Donc tu vois, toute la machinerie là, autour de l'administration pouvait faire en sorte que vous arrivez dans tel coin, il y a un problème qu'on aurait pu régler si nous avions des données réelles, si nous avions des données à temps réel.
Great, thanks, Popaul. Really appreciate the insights you're able to give us there from what's been going on in DRC. At this point, I'd like to bring Nico in then. And Nico, I know you're primed and ready to give us a quick overview of the dashboard that's been put together in this project. So Nico, at this point, over to you.
Yes, thank you, Rob. So I'm going to present very quickly how the different dashboards developed by Kinshasa Digital works and what kind of insight we can get from it. So here I've selected the dashboard on the impact on mobility. And there's different options I can choose. So here I've decided to look at granularity by province and on the time granularity of one day. And I focus my analysis on the province of Kinshasa here in green. That's where the epicenter of the 19 epidemics started. So what I see on the map and on the different figures here, it's what has been the impact on the mobility 2 periods. So the period of reference is just before the lockdown has been put in place. So it's in March last year. And then I observe 1 month just after really look at what has been the situation just after. And then in terms of indicator, it's all about mobility. Then here we make the difference between the incoming mobility and the outgoing mobility. Epidemics, it's important to know if we want to focus on the people that's entering specific area or that are leaving a specific area. Of course, because Kinshasa was where the COVID-19 epidemic started, it's more important to look at where those people are living. So, for example, we want to look on and focus on the outgoing mobility, and what is here the presence is the attendance. So it's not especially the mobility, but people that are detected in the city, in the province. What we can already see that both mobility, the incoming one and the outgoing one, have been impacted drastically. Like we see a huge decrease, so we can see that the lockdown has worked, but the attendance hasn't changed much, meaning that actually it seems that on the province level in Kinshasa, that many people have left completely the city. They've cut the incoming and the outgoing mobility. But actually, if we go a bit deeper in the analysis, thanks to the power of the mobile big data, you can actually see some big disparity within the city itself in terms of attendance. Area in blue are the one where we see a decrease in terms of attendance. So we can see that, for example, Gombe in particular, which was South District within Kinshasa that was the most affected. You can see there actually the attendance has been reduced. And in some other areas, like the suburban areas here in red, you can see an increase of the attendance. So it suggests that maybe there was a kind of transfer of people that's left Gombe and some other areas, maybe to some suburban area when Gombe was in full lockdown mode. So in kind of internal mobility within the Kinshasa. So that's the first thing we can observe, that some action can be taken with those facts. Then if we go back to the outgoing mobility, actually we want to go specifically on the district of Gombe, which is green. What I see for Gombe is that the outgoing mobility has decreased even more, like 81%. So of course that was expected. But what is also important is to see that although that's a big success of the lockdown, there's still some increase of outgoing mobility that have happened from Gombe, and that's why you want to know that, because that's potentially threats to a virus, to the COVID-19. Well, if I back at my map, I can see here with the color, the one in orange are the mobility, outgoing mobility that have increased after the lockdown. And in particular, I can see that here in my bar charts, that the outgoing mobility from Gombe to Karizimbi has increased a lot, like more than 3,000%. So in terms of nominal value, it's not that many people. We're talking about an estimation about 1,000 people. So it's not a lot, but it's potentially those 1,000 people are potentially threats for spreading the virus. And you can see that Karizimbi is like an important city near Rwanda. And what we observe is that actually the COVID-19 went to Goma a bit after. So it might caused by this. So that's something you can spot quickly thanks to mobile big data, and some action can be taken quite quickly thanks to this data. So that's just an example of how this data can be useful. This impact on mobility can be useful for the decision maker when you want to find an epidemics. And maybe quickly. The other use case that has been developed by Kinshasa Digital is around the monitoring of hotspots. So all the different area of color you can see are different hotspots that have been defined by the secretariat technique with the help of Orange and Kinshasa Digital, and they represent a kind of potential high attendance, potential cluster be linked markets there, or because there's a church or a bus station or an area with factor. But those are those area of interest we want to monitor. And what we see on this map, I've selected a bit randomly a specific date. I've selected just after Christmas, the 26th of December, and I compare this to a situation the week just after. So what I see, average, is within all the hotspots in Kinshasa, I see a decrease of the attendance within those. I mean, around those different hotspots. So I mean that was what we could expect for such a day, like for the 26th of December, of course, because it's just after Christmas. But if you look more closely, different color, and the area in red actually represents an increase of the attendance, while the area in blue, the most of the area are colored in blue. So that explains why, on average, with a decrease of 13%. But some areas are in red, and that's where maybe you want to focus your attention. And of course, for example, the highest zone, the highest hotspots with the biggest attendance is the airport with a 24% increase. And I mean, maybe it's also kind of normal because it's a kind of a day where you would expect a bigger attendance at an airport. But then you see some other areas. For example, here I have some markets. Here I have a cemetery, and that's kind of maybe some areas you want to monitor more closely. Especially if during that specific day you knew that the virus were circulating a lot in the city, you want to focus on those areas where you had an important attendance. So yeah, that's in short some of the use cases that have been developed.
Excellent, that's great. Thanks so much, Nico. I suppose those hotspots you're identifying there as well, there's potential for that insight to be used for, I suppose, for things like educational purposes, or making sure there's information campaigns around those hotspots as well, potentially for the citizens to make sure that they're aware of the risks and what can potentially be done about avoiding some of the problems that can arise from contracting COVID. Maybe one final question just to wrap up this section. Obviously, really useful to be able to see the tool and to be able to understand exactly what the data looks like when it's visualized and is then presented to the end users. The stakeholders are going to be making decisions based off this. I suppose, looking forward to the future, how do you think this could potentially be enhanced going forward? What additions do you think would be useful to make in that sense?
Yes. I mean, an area that is create some epidemiological modeling. We are working. I mean, they are working closely with some people at the World Bank that are developing some modeling, and of course, this modeling is going to be enhanced with the mobility insight that we got from big data, and so soon we hope that this modeling and this risk modeling will be integrated into the dashboard. So you will not only see the mobility of the people, but in the same time you will be able to see how the virus itself is spreading and what is the risk of the spreads, which area are the most at risk because of this modeling. Thanks to this modeling, and it can also help potentially to a future vaccination program, try to prioritize which area, which zones within the country should go first, because we know they are most at risk. Is a new peak of the virus. Also, kind of mobility that can also be used for other type of epidemics than COVID-19. And DRC, the country that is unfortunately often facing important and severe epidemics. We think, of course, about Ebola, but there are some others as well. And we know that the secretariat technique is willing to use those new digital tools to fight those epidemics. Of course, the modeling will be different. The mobility impacts epidemics in very different. Every disease is different, and the human mobility affects differently those diseases. So it needs to be taken into account. But they can be used for that as well.
Excellent. That's great. Thanks so much, Nico. So the last thing for me to do in this particular section is to thank both Nico and Popaul for joining me to shine a spotlight on the great work that's been achieved so far in DRC. And I'd like to wish you well for the continuation of this work going forward.
Thank you, Rob.
So with those perspectives from Benin and DRC, it's clear that AI for Impact's COVID-19 response has been able to bring a significant impact to the focus countries. And we also know from our global monitoring that mobile big data has many more COVID-19 response measures around the world. And we expect that they will continue to support efforts to manage future disease outbreaks and support the economic recovery plans around COVID-19. Through AI for Impact's extensive engagement with both public and private sector partners, donors, and development partners, many learnings were gained that can serve as a foundation and guideline for current and future implementations of mobile big data analytics. And so I'm going to use the earlier introduced engagement framework to highlight some of them now. Whilst, of course, the specific use cases and partners will vary from country to country, the broad principles that underpins successful, sustainable implementation. On the screen are the best practice principles then related to the phase of the engagement process. So beginning with phase 1 on partnership creation, it's essential to understand and adapt to the local context. Mobile big data analytics is of course a global concept, but the most successful implementations of these projects largely depend on their relevance to the local environment. As a first step, then, supply-side ecosystem players, facilitators, and donors should make a careful assessment of the needs and concerns of the local area in order to achieve the expected outcomes. And the actions and decisions of these key partners throughout the project need to reflect the local context and complement rather than duplicate individual country efforts. Just as important is building collaboration within the ecosystem and clearly defining the roles and the responsibilities for the stakeholders from the outset of a project. Then at the needs assessment phase, seeking to understand the policy landscape to avoid future bottlenecks. Now, as the activities of mobile operators in any given jurisdiction and the handling of customer data are governed by specific policies and law, so that means that they need to comply with existing local law and existing international standards where relevant. And then perhaps where the data laws are not yet in place, the public and private sector partners really need to ensure that they adhere to the highest standards of privacy in lieu of a data protection framework. Could therefore help to establish a clear and practical data governance framework, and doing so from the onset of a project between the stakeholders involved around who should access data and in what form. Also, as the concept of mobile big data analytics is new to many governments and demand-side agencies, it's really important to upskill the demand-side workforce in this context. Moving then to the product specification phase, the supply-side partners must focus on the relevance of the final output for decision-making and value generation, and so ensure that the output is relevant and actionable. Need to do this to ensure the buy-in and adoption of products and services by the demand-side partners, but also not forgetting this will also incentivize donors and other facilitators who have an interest in the solution. For our audience from the demand side, it's also important to articulate a clear incentive for supply-side partners. So to encourage sustainable participation, and also to make sure to share data in a privacy-preserving manner to really build confidence and trust in the outputs. And here the final recommendation is to really empower key users and to co-create locally to ensure continuity of solutions. When it comes to implementation, it's really important to try to leverage existing resources, the technical solutions that need to be developed. So, for example, back-end algorithms, front-end visualizations, etc. Developing these from scratch can be both time-consuming and resource-intensive. Also, the ability to adapt to fast-moving scenarios is really critical. In urgent and fast-changing situations, such as during natural disasters and epidemics like experienced in COVID-19, stakeholders need to be prepared to move with speed and agility in the design, implementation, and adoption of mobile big data analytics products and services. Then looking to the adoption phase, it's critical to communicate the impact of a solution. And that's to all stakeholders in order to demonstrate the value and by extension to sustain momentum towards more widespread adoption. And then finally, when it comes to replication, we really encourage the review of previous projects. This can help to facilitate the design of new solutions and of course help to realize efficiency and scale. And then last but certainly not least is to focus on sustainability and replicability. This will help to incentivize partners on both existing projects, but also to potentially identify new partners and future project applications. Now, I'm conscious that I've quickly covered a lot of information there, but I'm pleased to share with you that AI for Impact has today published a new report, Utilising Mobile Big Data and AI to Benefit Society. Now, this report is a review and summary of the insights from the COVID-19 response using mobile big data and AI, and I'd really strongly encourage you to download and take a look at that report, which contains a lot more detail than we've been able to cover in today's session on both the in-country implementations as well as the lessons learned and guidance for developing solutions in the future. Visit the GSMA's AI for Impact webpage to access the report, and also there you'll be able to access the earlier series of blogs and webinars, as well as the AI for Impact toolkit that we've referenced throughout the series. So finally, to wrap up today's session, I would like to thank my guests, Nico Snell from the AI for Impact team, Dr Eric Adja from AFRIA, and finally Popaul Punza from the Technical Secretariat for the Response Against COVID-19 in DRC. Thanks to all of them for joining me today and taking the time to share their knowledge and experiences of the activity in their respective countries. So as a reminder, this initiative has been funded by UK aid from UK government and is supported by the GSMA and its members. And the views expressed do not necessarily reflect the UK government's official policies. Finally then, from myself, Rob Childs, thank you very much for joining us. I hope you found this session and the spotlights on the in-country engagements useful, and I would like to wish you all a great day. Thanks very much. Goodbye.